This presentation summarizes my capstone project proposal on improving early recognition of respiratory deterioration in adult patients on a med-surg pulmonary unit, which is our unit. The focus is on using a standardized respiratory assessment checklist, evidence-based practice, nurse education, and interdisciplinary collaboration to support earlier identification of clinical decline and safer patient outcomes. Respiratory deterioration is significant because patients may show subtle changes before they become critically unstable. On med-surg pulmonary unit, early cues may include a rising respiratory rate, increasing oxygen requirement, lower oxygen saturation, increased work of breathing, or mental status changes. Patients with COPD, CHF, and pneumonia are especially vulnerable due to underlying disease and oxygen therapy needs. The goal is to recognize decline early enough to intervene before a rapid response, ICU transfers, or prolonged hospitalization occurs. The target population includes adult patients admitted to Sunrise Hospital's Medical Surgical Pulmonary Unit. These patients often have respiratory related conditions, including COPD, CHF, pneumonia, and other acute or chronic respiratory concerns. Many require oxygen therapy and frequent monitoring because this population is at an increased risk for deterioration. A consistent respiratory assessment process can support safer care and earlier communication with providers or respiratory therapists when change occurs. Social determinants of health. So these are the factors influencing respiratory outcomes and follow-up. So this is important for this project because they affect how patients understand or manage and follow up with their respiratory conditions. Education and health literacy can influence whether patients understand oxygen use, medication adherence, and early warning symptoms. Access to care, like the follow-ups, economic barriers, housing, environmental exposures, or language barriers or social support can also affect outcomes. These factors can help explain why some patients may return to the hospital or have difficulty maintaining respiratory stability after discharge. The main problem for this one, so it's identified problems and gaps. So the main problem is delayed recognition of respiratory deterioration, especially in patients requiring oxygen therapy. Although nursing assessments are completed, subtle changes may not always be connected as a pattern. These changes includes increasing respiratory rate, rising oxygen needs, and mental status changes. In a busy med-surg environment like ours, competing priorities, staffing challenges, and different experience levels among nurses can contribute to delays. This gap matters because it can lead to late escalation and worse outcomes. So significance of the problem. So delayed recognition of respiratory decline has consequences at several levels. For patients, deterioration may lead to ICU transfers, rapid response activation, or prolonged recovery. For the organization, these outcomes may affect quality metrics and costs. For nursing patients, the issue highlights the need for consistent assessments and stronger clinical judgment. this capstone project is significant because it focuses on helping nurses identify early warning cues more reliably and escalate care before the patient becomes critically unstable. So for the literature synthesis, like what current evidence supports this capstone. So the literature supports the use of early warning systems, structured assessment, and trend monitoring to identify clinical deterioration. The colleagues evaluate Nurs. The early warning systems support timely detection, oxygen requirements improve preventive value. So while Price and colleagues evaluated Nurs across diagnostic groups, while Gonem and colleagues focus on dynamic early warning scores in respiratory disease. Clark and the colleagues found that adding oxygen fraction strengthened prediction in viral respiratory illness. And then Harrison and colleagues also emphasizes the importance of oxygen therapy in early warning scores. So overall, the evidence supports a structured approach to respiratory assessment and escalation. Technology, data, and AI. So using patient data to support safer decisions. Technology supports this project through electronic medical records or EMR, patient trend review, early warning scores, and the future AI-based alerts. So EMR documentation allows nurses to see changes over time in vital signs, oxygen use, and patient condition. Early warning systems can summarize risk, but they should be used with clinical judgment rather than replacing it. AI may eventually improve prediction by analyzing real-time patterns, but the main goal of this project remains practical bedside recognition and escalation. The purpose of the proposal. So the purpose and the SMART goal. So the purpose is to improve early recognition of respiratory deterioration in adult med-surg pulmonary unit. So the SMART goal is to increase timely identification of early warning signs by 20% within 8 weeks through a standardized respiratory assessment checklist and staff education. The goal is specific to the pulmonary population, measurable through observation and checklist used, achievable because it uses simple bedside tools relevant to safety and time-bound to the capstone project. So it's checklist plus the education, 20, and then fits workflow, patient safety priority, and then within that 8-week proposal timeline that I have. The proposed solution is a standard respiratory assessment checklist combined with brief education on early respiratory decline and oxygen management. The checklist includes key cues such as respiratory rate, oxygen demand, work of breathing, lung sounds, and mental status. This is designed to support nurses, especially newer nurses, in recognizing and escalating change earlier. The solution is practical because it does not require major system changes and can be integrated into current assessments. So the main stakeholders for this project are registered nurses, us, respiratory therapists, the nurse educator or clinical support coordinator, and the preceptor or unit leadership or CNCs. Nurses are responsible for assessment and escalation. Respiratory therapists support oxygen management and breathing treatments. Educators help reinforce best practice and support new graduate nurses. Leadership and preceptor feedback are essential to making sure the intervention is realistic, useful and sustainable in the unit's workflow. So the SWOT analysis shows that the unit has helpful strengths, including experienced nurses, interdisciplinary teamwork, and access to educator support. Key weaknesses include variation in experience level and a lack of standardized respiratory assessment tool. Opportunities include using EMR trends and early warning systems to support clinical decisions. Threats including staffing shortages and increasing patient acuity. So this analysis helps guide implementation planning and makes the proposal more realistic. So for the project timeline, so the first 2 weeks that I was doing this project, I was trying to evaluate the problem and the literature review with my preceptor, which is Lina, our CNC, and then within the weeks 3 and 4, the checklist design and the stakeholders. Weeks 5 to 6, it's the feedback and the workflow fit. And then weeks 7 to 8 is this presentation and my final proposal this month. So this timeline supports the gradual development, feedback, and the refinement before final presentation. So the barriers, leadership, and change theory. So 2 expected barriers are workload, staffing shortages, variable nursing experiences. And then the nurse's leader role is to promote evidence practice, support staff education, encourage interdisciplinary collaboration. For Lewin's change theory, this supports the process through the unfreezing, change, and the refreezing. So for the unfreezing, it's to identify the practice gap. The change is to implement the checklist and the education, and then the refreeze is to sustain this new practice. So the expected outcome of this project is to improve the early recognition of respiratory deterioration in our unit, which is the med-surg pulmonary unit. A standard checklist can help nurses assess important threats more consistently and communicate concerns earlier. So the project also supports patient safety, nursing clinical judgment, and interdisciplinary collaboration. Overall, the goal is not to replace nursing judgment, but to strengthen it with a practical, evidence-based tool that improves the timing and consistency of care. These are the references that I have for the project. Any questions? Okay. Thank you guys for listening. Thank you.